Today I'd like to talk about partial knee replacement, which is a treatment for arthritis. The majority of arthritis in the knee is limited to one part of the knee. Now that can be treated with a partial knee replacement or a total knee replacement. In my opinion, a partial knee replacement is a much better operation because it involves only treating the part of the knee that is involved in the arthritis. And there are lots of benefits for this. The main benefit is a smaller operation. It's easier to recover from, and you're preserving the rest of your knee for the future. We know that all knee replacements have a limited lifespan, and that can be anywhere in the region of 15 to 20 or even 30 years. However, especially if you're having a knee replacement at a young age, you should be considering a type of joint preserving joint replacement, which then allows you to have further operations in the future if required. The other advantage to a partial knee replacement is that you leave all of the ligaments in the knee intact. And that means that the knee moves better. It moves more like a normal knee, and generally patient satisfaction is a bit higher for partial knee replacements. And finally, it's a lower risk operation. It has consistently been shown that partial knee replacements have a much lower risk profile compared to a total knee replacement. Having said this, of course, a partial knee replacement is not suitable for everyone, and some people would only be able to benefit from a total knee replacement. This is definitely something to discuss with your surgeon at your appointment. So what is a partial knee replacement? Well, it's a procedure that allows us to be able to resurface only the part of the joint that has arthritis. It leaves all your normal cartilage intact. On the day of surgery, you'll either have a general or a spinal anesthetic. And what I normally do is I would expose the joint in a very sterile manner, and then the surface of the joint is reamed away and resurfaced with an artificial joint. And this is usually made of metal and has a very hard-wearing plastic in between to replace the cartilage. The idea is to restore the tension of the soft tissue and your ligaments to a point before you had arthritis, restoring the normal knee. And that's only possible because we have kept all of the ligaments intact. It's one of my favorite operations. And the reason for that is patients are consistently much better at 6 weeks after the operation. Recovery can take a while. Walking is encouraged from day one. The idea is to get you moving early. The more you move in the early stages, the better it is longer term. So what's recovery like after a partial knee replacement? Well, you'll be in hospital for a day or so. Some people go home the same day, and some people go home the next day. You'll have a big bulky bandage on your leg, which comes down a day or two after the operation. You'll probably be on crutches for about 3 weeks. Your physiotherapist will take you through that early stages. The main thing to do is to make sure you have your full range of movement back early. And that's what your physiotherapist will work with you to do. The earlier you get your range of movement back, the better it is longer term. After about 6 weeks, most people are back to driving, although some people are back to driving even before that. By about 2 months, you'll feel most of the benefit from the partial knee replacement, although studies do show that people continue to improve up to 6 and sometimes up to 12 months. You will need a bit of support in the early stages after a partial knee replacement. It's a painful thing to go through, and you'll need some painkillers, so it's a good idea to have someone to help you at home. The final thing to talk about is risks of the operation. It is a major procedure, and there are some risks associated with it. Thankfully, the risk of something bad happening is less than 5%, but some of the problems that can sometimes occur is a deep infection. This can be prevented by giving antibiotics, which we give as a routine, which we give routinely, but it still can occur. The thing that you will almost certainly have is some scar numbness. Some numbness around the scar. This is unavoidable and usually shrinks to a much smaller area, but it's something that you need to be aware of. Most people struggle to kneel on their knee to start with. Having said that, most people can do that eventually. What you might find helpful is kneeling on knee pads or rolled up yoga mats, and that allows you to get back to kneeling. The other thing that some people sometimes struggle with is stiffness, and that's the reason why you should really engage with your physiotherapy exercises early to make sure that there isn't a lot of scar tissue in the knee. Having said all of that, and to summarize, it is a very safe operation. It's one of the most successful operations in orthopedics, and it happens to be one of my favorite operations because I generally get very, very good results from patients very early after the operation.